It's 40 past the hour. Illinois Wesleyan University is promising to investigate the heat stroke death of the football team's co-captain. Doug Schmid died in a hospital intensive care unit Wednesday, 5 days after collapsing during practice. He was 21. Heat stroke is a medical emergency that must be treated quickly. And now there's a high-tech way to help young athletes prevent it. Byron Pitts has the inside story.
Here we go on the whistle. Dig it out.
At Pennsylvania's Westchester University, the gridiron is both practice field and laboratory.
Squeeze, spill.
These guys actually heat up pretty quickly.
For the past 4 seasons, head trainer Sandy Godak has measured the internal body temperature of her players to pinpoint those most at risk for heat stroke.
This is called a temperature sensor. It's silicone encased sensor that the players just ingest.
All-conference running back Osagi Osundi is part of Godak's research project.
How do you swallow this thing?
Drink a lot of water.
And it's pretty easy to get a reading.
Doing okay? His core temperature is up close to 101.
In the summer heat, oversized linemen can lose up to 15 pounds in practice. If their internal body temperature goes above 103, that's a warning sign, possibly leading to heat exhaustion followed by heat stroke. From Pop Warner to the pros, heat stroke and football have always been at odds. But the game has changed. Athletes are now faster, stronger, and yes, bigger. Last year, 3 high school football players collapsed on the field and died. The NFL got its wake-up call 4 years ago. That's when Corey Stringer, a 335-pound all-pro lineman for the Minnesota Vikings, collapsed and died of heat stroke. The league promised changes, and this season, for the first time, 3 NFL teams are experimenting with temperature pills.
How big are you?
350 plus.
Philadelphia Eagles lineman Hollis Thomas is all for it.
How valuable do you think this pill could prove to be for football players like yourself?
Keep us from dying.
Thomas and all-pro lineman John Runyon have both overheated in practice and needed treatment.
There you go. Nice job.
Runyon welcomes anything that might extend his career and his life.
If you talk to, I'm sure, some Hall of Fame guy who played pro football back in the 60s, you'll say, oh man, these guys are soft. Back in our day, we threw up at practice and you were supposed to lose weight and get dizzy.
Yeah, and they're all dying at 50, 60 years old, too.
I think, 5 years from now, everybody's going to be using it. And this is just another tool that we can use to put these players out there safely. But
as Wednesday night's death of this Illinois Wesleyan lineman shows, there is still guesswork and risk in a game played by giants. Byron Pitts, CBS News, Westchester, Pennsylvania.
Being young and in shape is no guarantee against health problems, even fatal ones. This is the time of year many young athletes are training hard for the new school year, and when sports medicine doctors begin seeing a lot more patients. Dr. Drew Stein is an orthopedic surgeon at the Hospital for Joint Diseases in New York who has seen more than his share of sports-related injuries, and he joins us this morning with some insight and advice. Good morning, doctor.
Good morning.
What do you think when you hear this kind of story? And we've heard just last week Thomas Herrion from San Francisco also died. What do you think when you're hearing this and they're dying so frequently?
Well, this is just a product of guys being bigger, heavier, stronger, and they are pushing themselves harder, and they're also taking supplements, like ergogenic aids like creatine, that also raise their metabolic rate, and that causes dehydration, and so they put themselves at huge risk for dehydration. Like you just heard, they're losing 15 to 20 pounds of practice, and that's one practice. There's 2 practices in a day, morning and afternoon, so they can lose 30, 40 pounds in a day just from sweating.
You would say, well, drink more water. I mean, is there something they can do to
There's only
this?
so much water that you can drink. Eventually, the water settles in your stomach, and it doesn't go anywhere. It just accumulates in your stomach, and that's when you get cramps, and that's when they start vomiting. So that's what these pills are trying to judge. They're trying to judge gastric motility and intestinal motility in relation to dehydration.
Now, again, these are young athletes we're talking about. As a parent who has maybe a son playing football or a daughter running cross country or something like that, what do you need to do to help keep them safe?
Well, the main thing is you need to adhere to the saying, once you're thirsty, the race is over. So they need to be hydrating. That's very important, especially on very hot days. They need to be in good shape. They need to have their body fat down. And these linemen that are dying are 300 plus pounds. So their body fat is very high, and they're just overheating themselves.
And really, you can't, this isn't something that somebody's going to be more predisposed to than someone else just by necessarily, I mean, if you're heavier, you might be more predisposed, but there's no condition there.
People sweat differently. Some people are predisposed to it, and they do a lot of testing in labs now, sweat labs, to see which guys sweat differently and if it puts them at risk for this dehydration and overheating.
But again, this isn't really something that your child will know necessarily out on the field or, or anything. Is it more you just have to warn them over and over?
Just have them keep drinking.
Keep drinking fluids. As far as other injuries, do you see a lot of injuries that will last a lifetime with some of these student athletes because they are so competitive, especially when they do get to the high school level?
Not really, but you warn parents because there's always a risk of that. The main difference between kids and adults with athletic training is that kids have growth plates and they're still growing. Growth plates are at the end of the bones, and they're soft cartilaginous ends of the bone where the bone grows from. And in adults, we get injured at muscles, tendons, and ligaments. Kids get injured at the softest part of the anatomy, which is the growth plate. So there is a chance for permanent damage. That's why we need to monitor these kids.
And really all there is the school physical. Normally when you start a school year and start school sports, can a parent do anything extra than that? Because that's pretty basic, really.
Not really. I mean, they need to just be clued into pre-season training and really focus on what the child needs to do to stay in good shape. Really, that encompasses 4 different things. One is strength training. One is flexibility training. A third is sport-specific training, and the last is diet.
No. Diet. Expand on that. How does diet?
Well, diet, we know that the American Dietary Association has changed the food pyramid. They added activity levels and they added portions. So they're trying to control the adolescent obesity problem. We just saw this Harvard School Public Health report that 80% of Chicago schools are within a half a mile of a fast food restaurant. That's pretty discouraging when you're trying to teach kids good food habits. Another thing about diet is we've all changed the way we eat. We all increase our protein, decrease our simple carbohydrates. We try and increase our complex carbohydrates. So we should be getting that across to kids as well.
And that can make a difference for a lifetime.
Yeah.
When the instances we've heard of as far as athletes being seriously fatally injured, what are the differences? Can these all be pretty much written off to the same thing, or are there other things?
Well, there's what we just saw was the linemen, the bigger guys, and especially in football season where they're out doing 2-a-day practices in summer, these guys are overheating. They're getting dehydrated and heat stroke. But there's other kinds of serious injuries that we see in basketball players, the sudden death from heart problems called cardiomyopathy. These are other problems, totally unrelated to heat stroke, but they're even more serious.
And with that, there's nothing you can do to prevent that.
There's no warning signs. There's nothing you can do. There's
no predisposition to it that can be traced in a medical exam or anything like that.
Not for preseason physicals.
All right. So the bottom line is, as a parent, be diligent. And don't expect the coaches to take care of all
this. Be diligent and focus on strengthening and flexibility. They're equally important. It used to be frowned upon for kids to perform strength training exercises because they thought it would injure the growth plates. But now the American College of Sports Medicine really endorses strength training as long as it's supervised. They need to be supervised in order to make sure they don't use too much weight and they increase the repetitions and they have proper form.
All right, Dr. Drew Stein, thank you so much for being with us. Good advice.
You're welcome. Thank you.
And we'll be right back.